The following program is paid advertising by Colorado Dental Professionals, LLC.
Hello everyone, and welcome to Power Health Productions, where we keep you up to date on what's new in health and wellness. And today's topic is dentistry. So over the next half hour, I'm going to speak with an expert that can help you if you have problems with your smile, if you're missing teeth, if the dentures just aren't cutting it anymore, where there's a lot of technology and a lot of advancements that can help you change your life. And sometimes that procedure can happen in one day. I'm your host, Jeremy Hassel, and I'm so excited to introduce all of you to an expert in the field. We have Dr. Eric Benefield. How are you feeling today, Doc?
I'm good. How are you, Jeremy?
I'm excited and really inquisitive to find out about how you actually do what you do. Now, watching, we have millions of people who have problems with their bite. They might hide their smile, or they're missing teeth. What would you say to them?
Somebody who has major problems, the kind of patients that I see have issues with their whole mouth, it becomes sort of the focus of their life. I mean, it's always there in the background. They every day, no matter what they're doing, their teeth problems are just there. And so my biggest message to them is there's hope. We can get through it. We can get you to life again without thinking about this handicapping problem.
And I was doing some research on you as well and seeing that you do dental implants. What exactly is that?
And I'm grateful to live in the age of dental implants. It opens up so many options for us that wouldn't be there without. It's a way to kind of start over with a new foundation. So, imagine if you had an old building that was kind of falling apart. That's kind of how a lot of people feel about their teeth. There's it's falling apart. There's really no hope. Implants give us a brand new way. Imagine pouring a whole new foundation and just building from scratch on that. That's kind of what implants do for us.
And with the implant, is it like a real tooth? What are you actually putting into the mouth?
So a dental implant is kind of like an artificial tooth root. So it's about the same size and shape as a tooth root. It's made out of titanium, which our bone grows and attaches to titanium. And so where the bone expects there to be a tooth root there, when that tooth gets lost, we can put a dental implant right in that same root space where the bone expects there to be a root, and the bone grows right up around it and just treats it like a tooth root.
So what if someone is wearing dentures, and it's been around since forever, I believe, the denture, and they put different things to hold it in place and whatnot, but they're missing flavors because it covers a lot of their palate and things. Why aren't more people doing implants and still doing dentures?
Dentures are an interesting thing because they look like teeth, and that's about it. If you and I could experience a denture for an hour, we'd be done.
That's it? Okay.
Yeah,
okay.
we would be done. So they look like teeth, but they don't function like teeth. They're not the same as having teeth. They rest on your gums. A lot of people have to use glue, and they don't like the taste of the glue, the feel of the glue. It's just the whole process is kind of disgusting to them. And I've had so many patients through the years who decide they're done, and they come to me and say, I'm tired of whatever it is. I'm tired of the glue. I'm tired of the flavor of things not being right. I'm tired of having my palate covered. I'm tired of these teeth moving around. I want something that's more like teeth. That's when we talk about what we can do with dental implants. And so again, there's hope. Tired of this denture, or maybe they don't even have a denture yet. Maybe they know somebody who's had dentures and now they're facing real major problems in their mouth, and they're thinking, wow, I think I might need to get dentures, and I'm terrified of that because I know so-and-so who has them and they don't like them, and I just don't want to go through that. They don't ever have to experience that. They can go right from whatever their problems are to a dental implant supported set of teeth and not have to worry about all those issues. So I would tell a denture wearer, if you're tired of that and you want something that functions like teeth in addition to looking like teeth, then let's talk about dental implants.
And with dental implants, what is the Esteem dental process?
So it's pretty amazing, honestly, whether you're already wearing a denture or whether you feel like you need to have your teeth out and you don't want to get a denture. Esteem dental implants is a way to build a whole set of teeth supported on implants. So when you bite, chew, smile, talk, whatever, those teeth are fastened to your jaw just like natural teeth are. And so life just goes on like normal. There's not this big change that has to happen unless you're already wearing a denture, and then it's a really good change.
Then it's a great one because you don't have to worry because you're saying they're fixed teeth that are actually in there functioning like real teeth.
Yeah, they don't come in and out.
Wow. And I see the process can happen in one day sometimes?
Yeah.
Tell me about that.
Yeah, in fact, let me show you a picture.
Okay, let's do it.
This is a patient named Melinda. So like all the patients that come to my office, Melinda had what she felt like was a mouth full of problems, not just a tooth problem. And so she came to us because of our reputation. That's what we do is full mouth dentistry. Melinda didn't feel like she was very functional. She only had, maybe 5 or 6 teeth towards the front that were working. So, our teeth in the front aren't really designed to do a lot of chewing and functioning and grinding up our food. Mm-hmm. So she didn't have back teeth that she could chew with. So, the functional part of things she felt like was gone in her mouth. Also, she didn't like the cosmetics of the way it looked when she smiled because she's missing her back teeth and some of her front teeth were broken down. And she came to me just, kind of saying, what can we do to get a full smile again? But, where you ask, can it be done in one day? One of her fears was, what's it going to be like to go through, it's kind of terrifying for people to think about what's going to happen after I get my teeth out. I mean, you're going to take all the rest of my teeth out? What's that going to look like? Now, for her, it was just her top teeth. But even then, she's like, are things going to look like? How are things going to feel? So it's a pretty scary thing to think about for a patient. And so she expressed that to me, and we talked about the Esteem process, where we can go in and take the teeth out, put in the implants. We've already got a temporary ready to go that fastens into those implants. So we took her teeth out. We did it under sedation so she wouldn't be scared. When she's sedated, we still numb it. Some people wonder, if I'm sedated, is it still going to be hurting, but I'm going to be sedated? So the answer is no. When a patient is sedated in my office, we still numb after they're sedated. So the scariness of the numbing doesn't come into play because they're sedated when we do the numbing.
Okay.
But we still do the numbing so that they're not sedated but hurting, if that makes sense.
That makes a lot of sense. You're right now, because the scary thing is, especially looking at her before picture, because she's like, all of the back of my mouth is a mess. What are they going to do? Am I going to have any teeth left? So the process alone is overwhelming. And you're like, no, we're just going to step it out. Mm-hmm. And the sedation is safe. And you're also numbing, so you're helping the process. And to see the before picture and seeing all of these problems, even her bite looks different in the first and the second.
Yeah, cosmetics was a big thing for her in addition to function. So she kind of wanted it all. I want things to work right. I want things to look right. And so the Esteem process was perfect for her. It's really nice because it's very methodical. When we do teeth in a day, a patient like Melinda can come in, go through the sedation appointment. We remove the teeth. We put the implants in. We fasten those custom temporaries to the implant, and so they leave that day with just what you're seeing, a temporary that looks like real teeth, that functions like real teeth while their implants are healing. After the implants have healed, then we convert over from that temporary, which wouldn't last forever. It's pretty long lasting for a temporary, but eventually it's not made of a material that's designed to last for a lifetime. And so eventually we convert that temporary over. Go ahead and flip to your next picture. That's her final.
Oh, wow. Even just seeing, before I even get to her mouth, her eyes look different to me already.
See how nice that looks? Can you imagine the feeling that she has, having known what it was like to have all those problems before, to realize that she's got a fixed set of teeth that function like regular teeth, that look like a beautiful set of teeth. So she accomplished all of her goals without really having to go through a scary process or a major life change. From one day to the next, she went from, these are the problems that I have, to this is exactly what I was hoping for. Can you imagine what she feels like?
I can see what she feels like. It's beaming when I look through the photos and see the befores and afters. She was great with the temporaries, but then when you put the final teeth into her mouth, her smile opened up. There's energy about her. It looks a lot different. It really actually is life-changing because our mouths are so important, talk about the health benefits. Because I'm looking at her before and then coming to here, it has to do something as well, right?
It does. So before we talk about health benefits, think about the name, Esteem Dental Implants. Think about before, what you see. Uh-huh. Now, she doesn't look sad.
No.
But what she expressed to me is, I don't like the way my teeth look. How is her self-esteem? It's low. The types of patients that come to my office, and we'll look at some different problems that people are facing, you'll see that no way that they can feel great about their smile, either the way it looks or the way it functions. And then you fast forward to the end, what kind of a change does that make for the rest of her life? It truly is life-changing. It brings back that self-esteem.
And it shows. And there are a lot of intricate details now that I'm really looking at her mouth for all the stages.
Yeah.
It looks like her teeth have been shaped and the color of these are totally different. Tell me about that process.
So the cool thing about the temporaries is we can use them as a gauge.
Okay.
Right? So we know where she started, and so we can look at the tooth shape, the tooth color, all that stuff, because cosmetics was a big deal to her. It was important. So it was important to me to get it just right. When we made the temporaries, we chose a color that we thought might be right. But she's only going to wear those temporaries for a few months. And so while she's wearing the temporaries, she can figure out, are these teeth too long or too short or just right? Are they sticking too far forward, too far back, or just right? Is the color too light, too dark, or just right? So we can really customize the final according to when we use that temporary as a gauge.
That's great. That's real life experience. You're taking your new teeth for a test drive in a way.
Absolutely.
You get to see them and feel them and go, okay, here's something I could change. But what I want to know from you is, what did she say after?
She was beside herself. I mean, she loved her temporaries. By the time somebody's been wearing their temporaries for a while and the temporaries look good and function good and everything, then it's almost like they kind of forget what it was like before to have the problems. But then when you go from the temporaries to the final, it's just kind of like one more step up, even where maybe they thought it couldn't get any better, it does. And so, yeah, I mean, she was just beside herself. You can see it in her eyes. You can just see with the way she looks. She was thrilled.
Absolutely. And with the Esteem dental process, here's proof of it right here. That's what it's there for. And also, I know you're an expert in full mouth reconstruction. What is that?
So the same thing that we did for Melinda, we can do that on the top and the bottom teeth. Now, she didn't feel like she needed it on her bottom teeth. Ironically, after we got done with the tops, she said, I think I might want to do something on my bottom teeth so that they look like a good match for the top ones.
Okay.
And the bottom ones hadn't been an issue for her until she saw how amazing the top ones could be.
Wow. That's interesting. She was like, okay, she was fine with how it was before. She didn't realize, like a lot of us don't, that there's actually levels. So when you have the top that are perfectly shaped for her face and everything, the bottom just wasn't cutting anymore. And you were like, well, yeah, we can fix that too.
For sure. Anyway, back to your question. I mean, one of the big focuses in our practice is full mouth restoration. So the types of patients that come to me feel like they need a big change. And there's a lot of different reasons. In fact, can we go through some pictures?
Oh, absolutely.
So this is a patient that I saw years ago. You can see how crowded her teeth were. She had a hard time with the cosmetics. She had a hard time with function. I mean, you can just see that she was totally embarrassed. So that's one thing that people deal with as a problem, is they're just ashamed of the way their teeth look. Another common problem is just, people feel like they don't like the way their teeth look because they're crowded and they don't want to go through orthodontics. And so they come to me to try to figure out, how can we make these teeth straight without going through the straightening process.
Wow.
An example of severe tooth decay.
Okay.
So you can see on the top, there's
discoloration. The teeth look weak over here. They don't look healthy at all. Even from the gums down, you see the problems.
Yeah. This patient thought they were going to have all their teeth pulled out and dentures. I mean, she was convinced that that's what she was going to have. And she was pleasantly surprised to find out that her teeth could be fixed if she was willing to go through the process. Here's a patient who had severe wear. You see how tiny those teeth look? Those have been ground down over the course of time. This is that same patient. Can you see on those front teeth, those little, it looks like pink holes?
Yeah, in the middle of the tooth.
Mm-hmm. That's an exposed nerve.
Oh.
Right in the center of the tooth. Every tooth has a nerve. So eventually, if you wear your teeth long enough, you get to the nerves. And so this patient came to me because they were in pain. So next one, you can see this patient's missing the majority of their teeth. Can you imagine trying to eat with just those few teeth?
That's not a great experience at all. You're having trouble eating, you don't even eat certain foods because if you only have a few teeth.
That's right. Do you know the first part of our digestive system is our mouth? So
Yes.
our teeth are designed to pulverize food before we swallow it so that we can uptake all those nutrients. Hard to do that when you're in a situation like this patient. This patient is missing all of their upper teeth. And so, some people are missing all their top teeth and their bottom teeth. There's a lot of solutions there, but before we get to a solution, that's a major problem to deal with when you're a patient who's facing, I want to eat, but I don't have teeth. That's hard. So that's a major reason why people come to see me, is if they're missing all or most of their teeth. All of these problems, you and I have a hard time identifying with them because we have all of our teeth and they're all healthy. But problems like this don't happen overnight. A lot of times there's a reason why these things happen. And so a person will see this happening slowly over time, but maybe they feel really afraid or really embarrassed. Like if I go to a dental office, it's going to be painful, or I'm going to be super embarrassed and they're going to be judgmental of me, or whatever. So the reason I show you these pictures is this is what we see every day. So there's no judgment. People are afraid that if I go to see Dr. Benefield, he's going to look at me and I'm going to be embarrassed. That's not the case. This is what we do. We help people go from a full mouth problem to a full set of beautiful, functional teeth.
And changing their life in the process.
Absolutely. Here's an example of somebody who just wanted a cosmetic makeover. Just because somebody wants a big change doesn't mean they're a disaster. Sometimes it's just, I don't like the way my teeth look. Functionally, I'm fine, but I want them to look whiter or straighter or longer or whatever. And so patients come to us when they're looking for a big change.
And this one, it seems, and also you help with the gums as well?
We do, yeah. We really try to, we don't take a cookie cutter approach to, every patient who has problems gets the same thing. That's not the way we look at it. We're fully trained and fully capable in my office of doing everything that needs to be done. So whether a patient needs, one specific type of treatment, or if they need a whole variety of different things, then we can do it right there. So that's another reason why a lot of people come to see me, is because we can do everything in our office. This is Vicky. She wouldn't smile. Like what you see, that was her smile. She absolutely was mortified of her teeth. And so for her pictures, you can just see her demeanor. When you look at her face, she's just not happy.
Not happy. That's what I was going to tell you. Right away, it's just a serious look. And if she doesn't smile at all, that means she looks like this all the time.
Her personality would come out when she wasn't having her picture taken. But when it was time to take a picture, we could not get her to smile. And so to take somebody like that, who just feels stoic about life, that's Vicky. That's a big difference, isn't it?
Wow. And as I'm seeing more and more of these, how custom you make it, I see the teeth look shaped. They're a great color. She had to just look at you after and just smile. What did she say to you after this?
Their life has completely changed. You can see it in her eyes. You can see it in just her demeanor. She is thrilled with life again. She can smile. She's a beautiful woman. Before, it was just her teeth were consuming her thoughts, her everything. She was embarrassed. Think about how often we use our teeth. When we're talking, when we're chewing, when we're smiling. We use our teeth all day, every day. And so if your teeth in your mind are a problem and you're embarrassed of them or whatever, then it's always there. It's just always looming. And so you always have to hide them. People learn how to do this, or, just cover them up.
Yeah.
Men will grow a big mustache. There's a lot of things that people do to learn to cope with this problem. But once we fix the problem, then the true light shines forth. You can see it on someone's face. You can see it in their teeth, but you can see it on their whole face.
Absolutely. In her eyes.
Everything changes. Yeah, it's awesome.
Well, that's the whole process. And as you explained before, it's the Esteem dental process. But it's showing to me and to all of you at home watching this, he can do this for you. This process is not a one size fits all. Even looking just at Vicky's picture from before and after, I get to see the difference. Her esteem is through the roof. I mean, she even has her hair swooped, the eyes are it's the first change to the next version of yourself. That's just incredible.
Yeah, absolutely. This is Christy. Christy came to my office and said, I am terrified. I've hated my teeth my whole life. I have finally reached the breaking point. And it's taken a long time to get me here. In fact, she's one that said, I started watching you on TV years ago. Okay. And I made it my goal to come and see you at some point and have my teeth fixed, but it's taken me this long to get here. The reason why she finally came in is because she bit down on something and her last back tooth crumbled. So she had like one final spot that she was able to function with, and it fell apart. And, you know, that was like the last straw. And so she made an appointment and she came in. And before I saw her, one of my team members was with her. And they came in and said, hey, Christy's here and she's really nervous. They kind of gave me a rundown of what she had told them. And I was finishing up with another patient. And so I said, can you go ahead and take some pictures so that by the time I come in and talk to Christy, we can have her pictures and look at them together. And my team member said, Christy hasn't allowed anybody to take a picture of her in 21 years.
Oh, wow.
And I said, wow, you know, we need to get some pictures. And so just see if she'll let us. And she did. She cried through the whole process of allowing her picture to be taken because she had just built that wall. You know, she just, it was a no-go for anybody to take a picture of her. She had never taken a selfie with her cell phone or anything like that. And so by the time I saw Christy, she was pretty emotional because she had just been through this photo shoot. But she was that motivated to get it done. And so she was willing to let us take those pictures. So you can see what she didn't like. I mean, she just felt like her teeth were flared forward and it was hard for her to close her lips over the top of them. So she had all these functional problems like the back tooth, the last final tooth breaking down. But she also had these major cosmetic concerns. When we had our COVID shutdown and everybody had to start wearing masks, she said for the first time she realized that she could be herself because she was wearing a mask. And so she could actually have her true personality show forth to her customers because she was wearing a mask and she wasn't thinking about her teeth anymore. She wasn't embarrassed.
Oh, wow. For a world tragedy to give her a chance to feel like herself because her mouth was fully covered.
Yeah.
Wow.
And so fast forward, now it's been, you know, a year since we've been wearing masks and she's starting to realize that we're going to stop wearing masks soon. And this wave of terror just went over her because she didn't want to go back to the way things were before because she realized who she was, her real personality had come forth and she just didn't want to go back. And so this is Christy's first selfie. We went through the whole sedation process and did, you know, tooth extractions and implants, everything that we've talked about. And so she got her teeth in one day. And of course she was terrified before because, I mean, she was super excited and also super scared.
Well, I can see here in the first before to seeing her face and her mouth and the after, this is more emotional than anything because if she never could ever feel comfortable with her own mouth, the mask made her comfortable. And then for the Esteem dental process and you and your team to take her to being as confident, take her own selfie and the smile she has, you've given her a new life.
The emotions that they experienced before are depression and, you know, just sadness, pain, embarrassment, you know, all those things that we've talked about. Once they go through the process, you know, they get up their courage to come in, they meet us, we figure out together what's going to be the right plan for them, we figure out the financial side of it together, and then they actually get to move forward and get their big problem fixed with a big solution. Can you imagine the emotions that they get to feel then?
They get to feel emotions they might not even have known they had because now they can be comfortable in their own skin and in their own mouth. So then they can do more things like be in family photos, not be scared to meet new people, not thinking about can I or can't I eat this? These are all the things that you and your team help them with.
Now you know why full mouth dentistry is so exciting for me. to change somebody's life, to truly change a life, is amazing.
It shows, because with all the befores and afters, with the multiple and different problems that your team using technology and your expertise can help all these patients, you're there to help. So everyone watching, I just want you to know, if you're even thinking about coming in to see Dr. Benefield, the consultation is free. You get to meet the team, see what's happening as we've showed you through this whole special. There are no problems that he can attempt to help fix to change your life. And so I guess in last words, what would you say to the person that's on their couch or sofa and they're thinking about it and they're like, maybe I should go in, or I'll just go in later. Anything you'd like to say to them?
I kind of see the same story over and over. It's a little bit different circumstances every time, but the story is usually, it took me a while, took me a long time. So, my message would be, if it's been a long time, if it's been years, that's okay. When you feel ready, come in and we'll take a look together and decide what's the appropriate plan to get you to the end. We don't want to look backwards. We're not going to judge how we got to the situation that we're in. We just want to get fixed. It's a message of hope. If I were sitting on the couch feeling like my mouth is a total disaster and I don't know what to do, or maybe it's hard for somebody to face when it's such a big problem.
Yeah.
If I felt like I had one toothache, like, oh, I got something back here going on, that's a different thing than this whole thing is a problem. And so if I'm sitting on the couch going, my whole mouth is the problem, I would feel relieved to know that there's somewhere that I can go that's not going to judge me, that's going to welcome me and do a no-fee consultation and do all the preliminary x-rays and images and everything that we need to figure out together what's the appropriate journey to take to get to the end point that I want to. And then they'll be able to do everything right there. If I knew that there was an office that's going to take me by the hand and just walk me through to the end, and when I get to the end, my teeth are going to become a thing of the past as far as my thinking about them and my worrying about them, and I'm just going to be able to live a normal life with teeth that I love the way they look, I love the way they feel, and I can just deal with the other problems in my life. That's the message that I would give to patients, is that's reality. That's what we do every day. So come in for a consultation. There's no charge, and let's figure out how to change your life.
That is great. I want to thank you so much for your time. And I hope all of you have any questions, any concern, or you want to change your life, come see Dr. Benefield. I'm Jeremy Hassel. Keep it positive, and we'll see you soon.
The following program is paid advertising by Colorado Dental Professionals, LLC.